Welcome everyone to today's Lunch with Mia event. My name is Patty Dorn and I'm going to be your moderator for this event today. And to start out for this event, we're gonna do a quick poll. I think, Joyce, can we do the poll or are we skipping that?
We're skipping that part.
Okay, all right. So no poll today. Today we're gonna run through some health insurance scenarios. And so some of us definitely learn better through real life scenarios. Instead of just watching a PowerPoint about life insurance issues, things like that. I think that kind of these scenarios help you learn. And so we've scripted some scenarios around common health insurance questions that we get here at the Maryland Insurance Administration and about health insurance. And so I'm going to be asking these questions to our Chief of Life and Health Complaints, Mary Quay. Please leave phones and your computers on mute for this event and cameras off, please. But you are encouraged to ask questions in the chat box. So you can open up the chat box and ask questions while Mary and I are interacting. And then when Mary and I finish with our scenarios, I will be asking the questions from the chat. And so with that, welcome, Mary.
Hi, Patty.
Hey.
Yes, I am the Chief of Life and Health Complaints, and I am happy to talk today about health insurance.
All right, thanks, Mary. All right, so I'm gonna go ahead and ask you the first set of questions about Dominic. So Mary, Dominic's health insurance plan is an HMO. And it's clear to him that in most cases, he needs to choose from the list of in-network doctors that the HMO provided. However, Dominic's primary care doctor referred him to an out-of-network specialist for his hand surgery. There wasn't a hand surgeon in his HMO network. So when the visit was processed, Dominic's HMO denied the claim. So is this legal? And what can Dominic do?
Okay, well, it's important to know that HMOs are a type of health plan that may have some extra laws that apply to them or different laws that apply to them. And because Dominic was referred to a specialist by an in-network doctor, then under Maryland state law, in most cases, the HMO must pay the claim. And that's minus any copays and out-of-pocket costs Dominic is responsible for under his plan. Ultimately, Dominic's HMO will likely need to reprocess the claim and pay the specialist. In a situation like this, we recommend sending an appeal to the HMO. And if the issue isn't resolved within 2 to 3 months, Dominic can file a complaint with our Life and Health Complaints Unit. If the HMO denies his appeal, he can file a complaint as soon as he receives that denial. And the Health Education and Advocacy Unit, which is in the Office of the Attorney General, can help him to file an appeal or a complaint. You're on mute.
Thanks, Mary. So next question. So Dominic spoke with his HMO and they informed him that they had straightened out the situation with the out-of-network hand surgeon. And he was informed that the HMO will be paying this bill. However, now a month has passed and the HMO still hasn't paid.
Okay, so Dominic or his healthcare provider can file a complaint with the Maryland Insurance Administration. Maryland's prompt pay law requires payment within 30 days of receipt of a clean claim. And this law applies to health policies issued in Maryland by insurers, nonprofit health service plans, and health maintenance organizations. To file a complaint about a possible violation, and also MCOs, which are Medicaid managed care organizations. To file a complaint about a possible violation of the prompt pay law, you can use the MIA's online complaint system.
Thanks, Mary. So another question about Dominic. So Dominic also needs treatment for both an anxiety disorder and the misuse of medications that he was previously taking for his anxiety. How does Dominic know if the providers that are listed by his HMO give quality care? So can Dominic find out if the providers are capable of treating both his substance abuse issue and his underlying condition of anxiety?
So this is tough, whether you have an HMO or a PPO or other type of insurance. The health insurance carriers are required to provide information about the networks to their members. And I would recommend that Dominic refer to his HMO's network of providers. Dominic can then reach out to the providers and ask questions to determine whether they have the training for the treatment he needs. And he should certainly ask if this is an area of expertise that they regularly practice in, and do they see patients with his needs on a regular basis. Dominic should not hesitate in reaching out to multiple providers so he can find the best match for himself and his situation. If none of the in-network doctors can provide the treatment Dominic needs, he can ask for the HMO to approve a request to see an out-of-network provider.
Thanks. All right, thanks, Mary. And then the next question. Dominic's primary care provider referred him to an inpatient treatment facility. Okay, so after 30 days of treatment, he feels like he still needs more treatment, but he thought the insurance had a 30-day limit on his inpatient treatment. Can Dominic's HMO limit him to 30 days inpatient treatment?
So what we're talking about here would be a contractual limitation where the policy says only 30 days. And if Dominic's HMO plan complies with the ACA, the Affordable Care Act, he must be offered coverage for mental health or substance use disorders that is comparable to benefits for medical or surgical services. And that means strict limits on treatment time would not be allowed in many circumstances. An ACA compliant plan.
Say that again.
Okay, what we're talking about is a contractual limitation. And so a contractual limitation which places strict limits on treatment time would not be allowed in many circumstances. An ACA compliant plan under the Federal Mental Health Parity and Addiction Equity Act must not make access to mental health benefits more restrictive than the benefits for medical and surgical services. If Dominic believes his HMO is violating the Mental Health Parity and Addiction Equity Act, he is encouraged to file a complaint with the Maryland Insurance Administration.
Thanks, Mary. All right, so I'm moving on to William. So William's children get their healthcare coverage through MCHIP, so MCHP, the Maryland Children's Health Program. But William himself does not qualify for medical assistance, so he doesn't qualify for Medicaid. What are his options? He said that he looked on the Maryland Health Connections website, and there is nothing that he can find that he considers affordable.
For starters, I need to mention that the Maryland Insurance Administration does not manage the Maryland Children's Health Program. It is managed under the Maryland Department of Health. The Maryland Children's Health Program, or MCHIP, gives full benefits to children under age 19, and the income limits for this program are higher than the income limit to qualify for medical assistance, or Medicaid. But William is definitely not out of luck. When he applies through the Maryland Health Connection, he can find out if he qualifies for financial help. Nearly 90% of applicants do qualify for financial help, and a very high percentage of them are paying a premium of less than $10 a month for their insurance. You can visit their website at www.marylandhealthconnection.gov or call 1-855-642-8572 for more information and to start the application process.
All right, thanks, Mary. And I'll put the website and I will put that phone number in the chat for everyone. And so the next question, Mary, is if William decides to take that path, what questions should he be asking the navigator that he contacts?
After William finds out if he's eligible to purchase a plan on the Maryland Health Connection, he should find out if and how much financial assistance he qualifies for. He should speak to the navigator about what the different plans cover and how much of the premium, the deductible, as well as any other out-of-pocket expenses he will be responsible for. If William has a primary care doctor or other provider he would like to keep seeing, he should find out if those providers will be in network. If he takes medication, he definitely needs to find out if his medications are covered under the plan. And if so, what do those medication copays look like? If William is interested, he could also talk to the navigator about his options for dental insurance coverage, which is also sold through the Maryland Health Connection. If William considers buying coverage outside the Maryland Health Connection, he also needs to ask if pre-existing conditions will be covered, and if the insurance company can refuse to renew his policy if he has any claims. There is a health insurance shopping tool on the MIA's website that can be used to keep track of important questions and answers if William is considering different types of policies.
Thanks, Mary. So the next question. So Shoshana was taking a medication for several years, but it recently stopped working for her. So after trying a few different options, her doctor told her reluctantly that he was going to need her to try a specialty drug. And so what does that mean, specialty drug? And why did her doctor try several other medications before the specialty drug?
Well, I can't say for sure why her doctor had her try several other medications, but it may have been cost related. Specialty drugs, also called specialty pharmaceuticals, are a group of drugs that are generally high cost and used to treat complex, often chronic conditions like cancer, rheumatoid arthritis, and multiple sclerosis. They often have special handling instructions and are often distributed through an IV. These drugs are usually quite expensive. If your health insurer covers the drug, your copay may be quite high. Maryland law caps the copayment at $150 for a 30-day supply after you meet your deductible. It's important to talk to your doctor or the pharmacy to see if you qualify for special rebates or other programs to help you cover the cost of specialty drugs and whether your health plan will allow you to apply those to your copay or deductible.
Thanks, Mary. So Shoshana has recently started receiving dialysis treatment, and she's now paying a copay for her treatments twice a week. She receives her health insurance through her employer, but is considering switching to a plan through the Maryland Health Connection. She's trying to find one with less out-of-pocket costs. Can she do this? Can she switch from her employer's plan to one on the Maryland Health Connection?
Shoshana may be qualified to purchase a plan offered on the Maryland Health Connection site, but there are a couple things she should know first. She is unlikely to qualify for savings. The financial assistance or premium tax credits would be unavailable to her as long as her employer is satisfying the minimum standards for affordability and coverage. And most employer plans do. Shoshana would then be fully responsible for the premium, while her employer-based plan is likely being subsidized, with the employer paying part or often most of her premium. If she is still interested, she can visit the Maryland Health Connection website or call for more information and to start the application process.
Thanks, Mary. And we did put the website for the Health Connection in the chat, as well as the phone number if anyone is interested in grabbing that. So the next question for Mary. Adam visited a doctor within his network. The doctor's office and his insurer confirmed that the provider was in network. He had already satisfied his deductible for the year, and he confirmed with his insurer that all he was going to need to pay was a $30 copay. So 2 weeks after Adam's visit, he received an explanation of benefits, or EOB, in the mail. He could see that the doctor's office had charged his insurer $650 for the visit, and the insurer had paid $450, the contracted rate. A week later, Adam received a bill for that remaining $200. Is Adam responsible for the bill in this situation?
If Adam's insurance company has a contract with this provider, in most cases, the provider will not be allowed to balance bill. And balance billing is what we call the difference between the allowed amount and the provider's full charge. However, if you receive services from an out-of-network provider, they may charge more than the allowable amount as they don't have a contract with your insurer. You may be responsible for the difference. And in this example, it sounds like Adam did his due diligence, and this is an in-network provider. He should contact the doctor's office, and if the problem doesn't get resolved, he should contact the Health Education and Advocacy Unit, which can help resolve billing disputes with providers. If Adam is in an HMO, he is protected from balance billing by state law. Adam can also contact the insurance company to see if they will talk to the provider about honoring the allowed amount from the doctor's contract.
Thanks, Mary. So the next question. In this case, Adam confirmed that his doctor was in network, so he likely wouldn't be responsible for the bill. But what if Adam's provider didn't have a contract with this insurer? What if Adam had found the provider's name listed on the insurer's website, but it hadn't been updated recently, and he unknowingly visited an out-of-network provider? Can they deny his claim, or can they only pay part of it?
For plans starting on or after January 1st, 2022, the Federal No Surprises Act applies. The No Surprises Act requires that if a member relies on the plan's provider directory and the information in the directory turns out to be incorrect, then the plan may have to cover the service with in-network cost sharing. And we will be talking about the No Surprises Act at a future at Lunch with Mia in February.
Thanks, Mary. And yes, we will have a lunch with Mia in February, and we will spend the entire time talking about the No Surprises Act. I think this is my last question for you, Mary. Caitlin thought she was getting a great deal on her health insurance with a new short-term health insurance plan. It was $200 a month. It had reasonable co-pays, and the contract stated that they will pay up to $1 million in claims. So Caitlin thought she just needed emergency coverage. That was what she was buying the plan for. Unfortunately, Caitlin was hit with that emergency, and she needed an emergency surgery to remove her gallbladder only 2 weeks after her plan went into effect. The plan denied the bill $30,000, saying she had symptoms before she got the health plan. Caitlin thought the ACA did away with pre-existing conditions. she can't imagine how she's supposed to come up with the $30,000. So did the ACA do away with the pre-existing condition exclusion?
Well, short-term health plans are exempted from the strict coverage rules of the Affordable Care Act, or ACA. And we referred before to using our health insurance shopping tool when buying coverage, because sometimes it can be hard to tell if you're buying an ACA plan. So a short-term health policy can deny you coverage for pre-existing conditions and exclude payments for common treatments. The lower premiums are a result of offering less coverage and medically underwriting coverage when they offer it. Closely read the details of any short-term health insurance plan before you sign up. Short-term plans have been around for a long time, and they exist to bridge short-term insurance gaps and are not meant as a long-term option. Always proceed with caution and consider other types of health insurance with longer durations. For more information on short-term health insurance policies, visit the Maryland Insurance Administration's website at www.insurance.maryland.gov.
Thanks, Mary. So with that, that does complete our health insurance scenarios for today. And so this is officially the Q&A portion. I don't see any questions yet in the Q&A, but if you do have any questions for Mary, now is your opportunity. Please, I do encourage you to type them into the chat. We do have a couple other things that we're going to post here in the chat. You're going to see, let's see if she already posted it. All right. So Joyce Peach just posted the link. If you want to sign up and receive information about these presentations in the future, she shared that link with you. You can sign up and we will send you the information about these online presentations as well as our in-person events. And that is in the chat. We also do ask for presentation feedback. I mean, we're kind of new to this outreach via online world too. So, you know, any feedback that we get from Marylanders with regards to if this works for you or not, or, you know, what topics you would like to hear from us in the future. We do appreciate that kind of feedback if you click on the survey and fill that out as well. And I'm still going to give you a minute to ask any questions if anybody has any. But seeing none. Well, I thank everyone for attending. I hope that this format was useful to you and maybe you got some of your questions answered. Again, please sign up to receive this information in the future or answer our survey. I just want to say that on January 26th at 12, we are going to be doing another lunch with Mia. So that's next Wednesday. And this is about local resources and services. So we're going to have 211, the United Way helpline there talking and answering questions, as well as the Maryland Department of Aging and the Maryland Durable Medical Equipment Reuse. And so that's definitely an issue. Durable medical equipment can be expensive, even with insurance sometimes. And they're going to be there talking about that program. You asked if the recording will be available, and yes, a recording will be available and shortly in the next few days on our website. One other thing, February 3rd, we also have a lunch with Mia. That's going to be on a Thursday. And we're going to go over different scenarios covering situations related to liability insurance, or so related to liability. So this is going to be for homeowners, it's going to be for renters, and it's going to be for automobile insurance. And we're going to be running it much like this one, where we have different scenarios where it's one person asking the other. And with that, I hope you can attend one of our events in the future. Joyce says to look for the recordings if you're looking for this recording under the quick link -webinars on our website. Oh, Jane does have a question. How do I find out if my Medicaid could be cut off? I have Medicare, Medicaid. Is that something that you can answer, Mary?
I'm afraid not. We do not run the Medicaid program. So the Maryland Department of Health is probably a better resource for that. And if you have questions about Medicare and Medicaid, the SHIP program in your county's Department of Aging may be able to help. But Department of Health is primarily for Medicaid.
Thanks so much, Mary. Is there somebody online right now who can confirm the date for the No Surprises Act presentation in February? I don't want to get it wrong.
It's February the 16th. And if you look at our website later on today or tomorrow, there will be a flyer that'll be available and you can find out how to sign up for it.
Thanks so much, Joy. Joyce, is it possible that you can put a link in the chat? Okay. So what you're going to do is you're going to go to our website. If you want to look, if you want the links to the upcoming event, you're going to go to insurance.maryland.gov. I'm putting that in the chat right now. So you're going to go to www.insurance.maryland.gov, and under hot topics, you're going to find those links to the upcoming presentations where you can sign up. And the February flyers will be posted by the end of the week. So those events for February will have flyers posted on our website by the end of the week. So thank you so much, everyone, for attending today. Again, I hope it was a good event. Thank you to Mary for being here to answer any questions. And I hope to see you all again at another lunch with Mia. Have a great day, everyone.
Yep.